Okay. So you're at the Friend for Life Cancer Support Network office and also the Cancer Resource Center here at Baptist. We'll go in and see what we've got in here. Friend for Life Cancer Support Network has had space donated to it by Baptist Health Louisville for many years now. We're a completely separate nonprofit organization, but they've been kind enough to give us space over the years. So the space that I'm going to show you is both the Baptist space, and then I'll show you the section that's Friend for Life. Here in the Cancer Resource Center, people can come in and get all kinds of information about cancer, brochures that they can take, books that they can check out, and all kinds of other resources that are available in the community and as part of Baptist and that kind of thing. Kind of walk you through. We'll go in here. This is the multidisciplinary clinic. They have different kinds of things here, like lung clinic, genetics clinic. It varies based on the day of the week when they have people come in with that particular issue. So we're going to say hi to Stacy.
Hello guys, how are you?
And Stacy, you could tell really quick in like a sentence or two kind of what you do here and all the different things that take place in the clinic.
Yes, we do genetics, which is done on Tuesday mornings. People come in, they see a geneticist and then also a physician while they're here. They'll draw labs and then they come back usually about 2 to 4 weeks to have those follow-up appointments. Wednesday and Thursday mornings we do lung care clinic, and at that time they see a thoracic surgeon, and most of the time, a lot of times they will also see a medical oncologist while they're here.
Sounds good. Thank you very much. And then we'll go in here and see what else we've got. We also have folks that do research back there. We have a few different types of navigators. So when somebody's diagnosed with cancer, they obviously have a lot going on, and it's helpful to have somebody to kind of navigate them through the process. So one of the folks we have is a lung cancer navigator. You can meet April real quick if you will say just a word or two about kind of what you do.
Okay. I'm April, and I am the lung nurse navigator, and my job is to meet with patients who are getting a workup for a cancer diagnosis, in this case lung cancer. So they come to the clinic and they see an oncologist and a surgeon, and then if they have surgery or chemotherapy, I'm the nurse that will do their education for them and provide them with educational materials and be available for them if they just need to talk or need help with their appointments as well. So that's what I do.
That's it. Thanks.
Thank you.
Thank you.
And here are some rooms where they see patients here for those various types of clinics. Let's see. Looks like they are both out. We have Gigi is usually here as a survivorship navigator. What she does is talk with people that have actually already been through all of their treatment for cancer, because there are a lot of times there are a lot of side effects, ongoing things that happen after a cancer diagnosis. So she makes sure that they are on top of follow-up appointments. If they have any ongoing issues, she kind of helps link them up with resources and ongoing appointments. And then over here, also we have our social worker who happens to be out at the hospital right now seeing patients, and she helps give them resources and that kind of thing. And there's Gigi now. Actually, if you want to say real quick a couple words about what you do with survivorship.
I do the post-treatment care for survivorship. So what I do basically is anyone who has had a cancer diagnosis, they're done with radiation treatment or chemotherapy, their cancer treatment is over. Once they're over, I kind of come in and go over the whole process, making sure that they don't have any long-term side effects or lingering side effects, and then I also help them with community resources to keep them connected and to be a support for cancer diagnosed patients.
Awesome. I said most of those things about you.
Cool.
Fantastic. We'll keep going up through here. Sometimes we have a nutritionist that comes over here and talks with folks about nutrition, specifically dealing with chemo or radiation, because that has a lot of different side effects and what you can and can't eat. So she's there sometimes to put you up with somebody. And then say hey to Brittany and hey to Jasmine. Hi. They also help coordinate the program and then make sure that all the appointments get made and all those good things and a whole bunch of other stuff. Do you want to say any other words about what you do?
No.
Okay. Brittany, do you want to say any more words about what you do?
I do a lot of laminating,
Which is very
It's a
important.
very important job around here.
And then also here we have some other consult rooms and things like that for people whenever they have meetings to talk about kind of the different aspects of their cancer care. And I'll also show you one other place, a couple other places, and then I promise will be done. You have to edit out some of those things in the middle. We also have a big big conference area, so a lot of times they have tumor boards and things like that when they have a particular interesting finding for somebody that they need to talk that through with a few different doctors. They come and do that in here. Friend for Life has their board meetings in here. A lot of different things take place in this area. And then I'll show you couple other places, and then I promise we'll be done. You don't need to sit in the kitchen, it's dirty.
So you all take care of patients from like all types of cancer?
With all types of cancer. They do here both at Baptist, and then we do at Friend for Life as far as providing emotional support. And this is the Design Center. So this is where patients can come in and get a wig or a hat or a scarf or a blanket, any of those kinds of things. And they're all free to patients, so anybody can come in and get some things for them whenever they have lost their hair due to chemo. Sometimes they get cold when they're there, so they have nice blankets. A lot of these things are donated by church groups and things like that. They have knitting groups that make these and donate them. All the wigs are donated, so if somebody has a wig that they want to bring into the center, they have it professionally cleaned through Highland Cleaners, and they bring it back and can reuse and that kind of thing, and all free to patients. They also have some things like Look Good, Feel Better, where people can come in and learn makeup tips and scarf tying tips, because there are a lot of skin changes that go along with treatment, so that's very helpful as well. And then Tina's our nurse navigator, but she's actually out as well. She's a breast health navigator, so she talks to all the newly diagnosed breast cancer patients. And then this is our space. This is a space for Friend for Life Cancer Support Network. Judy's office is in there. She's our director, and I'm the assistant director, and this is my space. Probably could have cleaned up a little bit better. But it's really wonderful that they've donated this space to us, because otherwise we would have to raise a lot more funds to be able to even have an office space. But also the neat thing is that a lot of what we do is over the phone, or we can use that from an internet connection anywhere. So it's also not as important that we necessarily have an office space, but it's really nice being located here in the Resource Center, because patients are already coming in here for various types of resources. So it's one less stop that they need to make, and found that it's really helpful for them to just come over here, and then we can get some information about what they're dealing with and find somebody that has been through a similar diagnosis and treatment, so they can really talk to somebody that's been through what they're experiencing. They may have some really great medical care. They might have a lot of support through family or friends. They might have a lot of good support through all the other services, but really being able to talk to somebody that's been through the exact same diagnosis and treatment and knows what they're feeling, and it's definitely very different if you're diagnosed at 28 versus 62, so we try to match the same age and everything too, so they can really talk to somebody that's been there. So that's a little bit about who we are and what we do, and now you've seen the whole place.
We appreciate it.
Thank you for your time.